Good afternoon, students. Welcome in HCP lecture. Today I will start the remaining part of chapter number 9. Chapter is Hospital Formulary System from part 1, Hospital Pharmacy. Let us first shortly look at what we saw in previous lecture. Definition, introduction, then important terms for understanding the basic nomenclature of the hospital formulary. Now, first, hospital formulary means what? The formulary system in the methods by which physicians and pharmacists working through a pharmacy and therapeutic committee of the medical staff evaluate and select the medications for use in the hospital. Then definition of hospital formulary can be defined as an important document of the hospital containing a collective list of the drugs. This system is a powerful tool for improving the quality and controlling the cost of the drug therapy. Then introductory part of hospital formulary system we have studied in previous lecture. Now in short I will revise. Formulary means a collection of receipts. There are the different selected preparations formularies available, such as general use formularies, for example British National Formulary, that is BNF, and Indian National Formulary, etc. To promote the rational therapeutics and to avoid the unnecessary duplications, waste, and confusion regarding drug products, and the Pharmacy and Therapeutics Committee develops a hospital formulary. Then the hospital formulary system is the term used to indicate the way in which the hospital formulary is developed. Then next point is important terms for understanding the basic nomenclature of the hospital formulary. In that, first is generic name or generic terminology, then INN, then chemical names, then active ingredients and brand name. First, generic name. In that, it is the identification of the drugs and medicines by their scientific and internationally recognized active ingredients or by their official generic name as determined by the BFAD of the DOH. Then INN is an abbreviation for International proprietary name, that is generic name. Then chemical name, it is the description of the chemical structure of the drugs or medicine and serves as the complete identification of the compound, as like active ingredients and brand name. Okay, now today's I will start. The next point is organization. The hospital formulary consists of the three parts. First is part 1, then part 2 and part 3. Part 1, it gives the information on the hospital policies and procedure concerning drugs. Then part 2, drug products listing, and part 3, special information. Now first part include the following items. First is categories of the drugs, for example formulary, non-formulary, and evaluation and investigational. Then brief description of the pharmacy and prescribing, dispensing and administration of the drugs. Then pharmacy operating procedures and information on using the formulary. These are the first part including items. Then second part include the drugs products listings is the main body of the formulary. First is item entries and second is the indexes to the drug products listing. Then each formulary items will have a descriptive entry. Okay. Each formulary items will have a descriptive entry. The entry will vary in a length and content depending on the extent to which the provision of information and advice is considered necessary or desirable. Then through it varies from the hospital to hospital. In general, such formulary entries includes the generic names of the basic drugs or product, then common synonyms and brand names, dosage strength, then packaging and size stocked by the pharmacy. Then in addition to these is includes the usual dosages, special cautions, controlled substances, symbols and cost information. Then the indexes to the entries facilitate the use of the formulary. These includes the generic name, brand name, cross index and therapeutic index, etc. Then the third part is an extremely useful set the heterogeneous information on medicines. For example, dosage in renal failure, antidotes, tablets of sodium and potassium contents, then important drug interaction, etc. The format and appearance of the formulary is selected as per the suitability of the hospital. The size of the formulary should be easy to carry. Then pocket size is performed. Then copies of the formulary should be made available at each patient care unit, then emergency room, and be given to all members of the medical staff. Then a sample page from a typical hospital formulary is given below, that is for acetyl salicylic acid. Okay, these are the acetyl salicylic acid, non-opioid analgesic antipyretics. These are the aspirin, that is acetyl salicylic acid. Aspirin is used for the pain, fever, inflammation and prevention or stroke of the myocardial infarction. Okay, aspirin is used for the pain, inflammation, fever, prevention of stroke and myocardial infarction. Then the principal adverse effect of aspirin are gastrointestinal because of the risk of the Rise syndrome. It is used to the very limited extent in the children. Then description: colorless, crystalline or white crystalline powder, odorless, melt at the 43 degrees Celsius, freely soluble in ethanol, chloroform, ether and slightly soluble in water. Then stable in dry air, that is in moist air it is gradually hydrolyzes salicylic and acetic acid. Then indications of that: mild to moderate pain, then pyrexia, arthritis, arthritis, rheumatic fever, headache, muscular pain, and anti-inflammatory conditions. Then second, prevention of the myocardial infarction, then prophylaxis against stroke and vascular occlusion. Okay, these are the indications. Then contraindications: asthma, peptic ulcer, then hemophilia, hyperparathyroidism, then decalcifying tumors, gastric mucus, lesion breast, feeding, lactation, then children under 12 year, then impaired hepatic and renal function. Then these are the contraindications. Then preparations: tablets 75 mg, 150 mg, 300 mg, soluble tablets 350 mg, that is brands, and asafub 325 mg tablet, Wallace. Then dispersible aspirin tablets. These are the preparations. Then trade name: dis Dispirin and Mayorel. These are the trade names. Then dose and use: adult dose and child dose. Adult dose is oral 300 to 900 mg, 4 to 6 hours. When necessary, maximum 4 gram daily with food. Then child dose is the over 1 year, 80 mg per kg per day in 4 to 5 divided doses. These are the dose and use. Then storage in airtight container as it is stable in the dry air. Then precautions: it should not be used continuously. It in allergic diseases, pregnancy, asthma, impaired hepatic and renal functions. Children's below 20 years. Okay, these are the precautions. These are all about the aspirin, that is acetyl salicylic acid. Okay. Now I will stop here. Remaining part we will see in next lecture. Thank you. Oh no.